Hello, my name is Abby Calder, and I'm a VMA working here at NAIT. Congratulations on becoming a VMA. It's so great to have you here. Today I'm going to be explaining to you everything that goes on into a preoperative care for a feline neuter. I will explain everything you have to gather to ensure that our patient leaves as healthy and happy as they were when they came in. Okay, let's get started. First, it will be our job as VMAs to restrain the dog for its pre-anesthetic administration, if it will be requiring any. We can gather the syringe and which drug the RVT wants to use, so it's ready for them to draw and administer the appropriate amount when we're all ready. It's the RVT's job to calibrate the drip rate of the IV, as there are calculations that have to be made, taking into consideration the patient's weight, among other factors. And then there's the isoflurane machine. It should be checked that there are adequate levels of anesthetic and oxygen that we have already for the procedure. It'll be our job as VMAs to get everything ready for the RVT for anesthesia. There are many things that we have to gather to prepare for a feline neuter. First is catheterization equipment. This includes clippers, various lengths of tape that we use to secure the IV catheter in place for surgery. This will differ on the patient depending on the size of the cat's leg, the IV catheter itself, a syringe that we use to flush the catheter, the needle. You should ask the RVT which size they would like for the specific cat, because tomcats may need a thicker gauge needle as their skin tends to be thicker due to the testosterone levels in their body. Next, you'll need propofol. Eye lubrication will be needed once the cat is under anesthesia, so now would be a good time to gather that. Next would be intubation equipment. So this includes the intubation tube itself. You should grab a couple different sizes, like a 3 and a 3.5 or a 3.5 and a 4, because it's hard to tell exactly what size is necessary until the RVT is literally looking down the dog's throat with their laryngoscope. You'll need a tie to secure the intubation tube in place once it has been placed, so gather that at this time. Also, the laryngoscope will be needed for the RVT to look down the cat's throat during intubation. Now would also be a great time to gather the pulse ox machine. It should have been disinfected before the procedure, but just in case, disinfect the clamp that goes on their tongue or foot pad before placing it on the cat's tongue. Until you're familiar with each veterinarian that works in the practice and the technicians and their size preferences and everything, just ask what size gloves and gowns that they need for surgery. For both the veterinarian and the RVT, who will be scrubbing in, and the RVT will be assisting with the procedure. For a neuter, it may just be the vet scrubbing in, since it's a relatively quick and easy procedure. The vet will also need sterilized towels to dry their hands in between after they've done scrubbing and before putting on their sterilized gloves. Before the surgery starts, the isoflurane machine, the IV drip, the pulse ox, heating pad, and the thermometer should all be disinfected between procedures, and they'll need to be checked regularly in between to maintain good working order. So for a feline neuter, we will need to either pluck or shave the scrotal area, as this is where the incision will be made by the veterinarian. To pluck the scrotum, you grasp the base of the scrotum, pulling the skin tight, and then you pinch with your thumb and your forefinger in a twisting motion to kind of pluck the hair from the root, ensuring a smooth area for the veterinarian to work with. You can do it either this way, plucking, or you can shave the area. If the area is to be shaved, you can use clippers and shave approximately 2 or 3 inches around the scrotum and the penis, first going with the grain and then against the grain to assure to ensure you're getting the closest shave possible. Be very careful going around the anus and the penis and the scrotum, as these are very sensitive and thin areas. And then once you've done either plucking or shaving the area, you would want to vacuum the area to make sure there is no hair left over. And let me find my spot here. And then it's time for scrubbing. When it's time to scrub the area, we're going to use chlorhexidine soaked gauze and squeeze the gauze. You can do it two different ways. You can either squeeze it, place it on the scrotum, and then squeeze on the scrotum without pinching the actual scrotum itself, just kind of squeezing and pulling the skin mostly, but obviously not pinching the skin. You can either use this method or you can hold the base of the scrotum and kind of scrub side to side. It just kind of depends on the size of the scrotum and your personal preference, what you like better. You repeat this process until the gauze appears clean, and you can use depending on the size of the testicles, as I said. If the cat is a cryptorchid, which means that one testicle is undistended, you will shade the abdomen like you would for a feline spay. This is where the bladder will also need to be expressed to ensure that the veterinarian has had access to the undistended testicle. To express the bladder, take a clean bowl and place it below the penis to collect any urine. Locate the bladder in the midline and the caudal half of the abdomen, so closer to its tail. And then in a caudal motion, you kind of find, it feels like a balloon, the bladder, and you find it and you squeeze it and pull in kind of a caudal motion towards the tail once again. And then you squeeze it until you see a stream start to come out, and continue to squeeze in a gentle yet strong enough way to ensure that all the urine is coming out of the bladder. And then once you've done that, you can then scrub the area as you would for a female spay. So now the cat is ready for surgery. The cat can be left on the prep table or carried into the surgical suite. This would depend on the veterinarian's preference or what rooms you had available at that time. If the cat is to be moved, you would place your hand under the shoulders and under the pelvic area of the cat. And so lifting with both hands and being very careful not to touch the area you just scrubbed that you worked so hard on. Either way, the sterilized surgical pack can be gathered at this time and placed on the surgical tray once the vet has entered the room. Either you or the RVT can open the pack, being very careful to only touch the outside of the surgical pack, not the inside. And then once it is opened to a certain level, then the RVT who is scrubbed or the veterinarian who is scrubbed can open it up the rest of the way. That's to make sure that everything remains sterile. So that's it for pre-op. You may be asked to stick around and help the RVT and the vet if they need any extra assistance with anything, but typically at this point we would go and clean up the area that we did the pre-op in and start getting ready for the next patient. If you have any questions, just let me know. I'd be happy to answer them for you. I know it might be a little overwhelming to hear this all at once, but I'm sure you'll have this down in no time. Below I have some reference pictures for you to get a good idea of what you'll be working with before you get your hands on anything. Thanks so much for listening for me today, and I look forward to looking with you in the future. Thank you.